All right. Welcome back, everyone. Today I have Dr. Liliana with me. I don't want to botch your last name, so why don't you introduce yourself?
Yeah. Thanks, I appreciate that. Yeah, Liliana Sainato, and now Sainato Menardo. I've just recently been married, so it's quite long. This is why online I'm just Dr. Liliana.
Uh-huh. That's a mouthful for
Yeah.
sure.
Mhm.
Okay, so you are a pelvic floor physical therapist,
Yeah.
correct?
Yes,
Okay.
absolutely.
Okay, so what does your practice look like? Like, how are you different from other pelvic floor PTs?
Yeah, so I'm primarily a DPT, Doctor of Physical Therapy. So all PTs that have the D in front just means we have a clinical doctorate. So for us, it just means that we can um, assess a little more deeply. We can understand medication diagnoses and interact in more specific ways with other providers. But for me, I am also very tailored towards the holistic end of things. So I'm also a doula, also a massage therapist, and an embodiment coach. So I tend to bring all aspects of healing in when I have a pelvic floor client or patient come in.
That's awesome. So
Mhm.
how do you get educated in that?
Yeah, so a ton of different ways. It's really interesting. So with something like, a DPT degree, you have to go to graduate school because it's regulated. There's, even with massage, I have to take a board exam and all of this stuff. But with things like becoming a doula or becoming an embodiment coach, these things aren't regulated nationally or even by state. So a lot of times it kind of comes down to what every individual wants to do for their own education and what they feel is ethically aligned. So for me, I have a ton of education in understanding, female anatomy, or anatomy in general, but specifically female anatomy, physiology. So when it came to saying I wanted to be a doula, I didn't get any additional education. I just did a lot of self-study, a lot of research, a lot of reading, and then took the skills I had as with my continuing ed, even as a pelvic floor PT, and brought that in for my doula work. And the same thing for coaching. Coaching is a relatively kind of like new up and coming industry. And I don't know how much you've heard of coaching or your audience, but there you can get a coach for really anything. And it's similar to like a sports coach in the sense that, you don't have to be a professional in a field to coach someone in something that So I'm an embodiment coach, which for me just kind of means I teach people how to learn the language of their body and how to sort of like create the reality that they want with their life via the lens of, learning your body and learning what's true for you and expressing authentically. So I don't have any specific, let's say, certification in that either, but I've been coached many, many times. I do a ton of self-study, and yeah, there's a lot of I'm very intuition driven. So I have my big degrees, my a few really big certifications, and then a lot of other experience and self study and intuitive knowledge.
That's awesome. That makes you
Yeah.
really unique, I think.
Yeah.
And it's interesting that you said what you said about coaching because I am a registered dietitian in the state of Pennsylvania, but according to the laws, technically shouldn't be working with people outside of my state. But
Yeah.
that's only if I'm practicing what we call medical nutrition therapy, which
Right.
is not what I do currently. So I have to call myself a nutrition coach or an IC nutrition coach.
Yeah.
And, while that kind of irks me inside, it in the end, if it helps me help people across the world, it's worth it, you
Yeah,
know?
100%. And it's really interesting because I think when people ask, like, oh, what are your certifications? Like, I know it comes from a good place. And really, I think what they're asking is, like, can I trust your experience? Can I trust you in essence, right? But it's interesting because the certifications and the degree behind me, like, this is only necessary because of state regulations. And on the flip side of that, we have to understand that, like, things are regulated for a reason, and a lot of times it kind of comes back to control. So like what you're saying, like, I totally resonate with. And for PT specifically, like the reason I wanted to come out of that world and into the coaching world is for the same reason as you, is like, I can't do the emotional, spiritual, energetic work that I do, that I want to do. I can't do that in a traditional PT setting because that's not, covered in my state practice act. That's not covered by insurance. That's not, it's not deemed necessary. It's not, quote, regulated, so in order for me to practice what I think is necessary for healing, I need to pull myself out of that credentialing and out of that, typical framework. And and I'm sure you agree, and a lot of practitioners would agree, like there's nothing bad or wrong about that. And I think a lot of us needed to retrain that part of ourselves that was like, oh, I don't have a degree, I don't have a license, like I must not be good enough. And it's just not true.
Right. And for me, stepping into the IC, specialization, I felt at first like, am I an imposter? I'm not an imposter because I've lived with IC, but I spoke with a coach of mine, and she was like, you are an expert in this because you have had this your entire life. And in reality, I am one of 2 dietitians that I know of in North America that specialize only in IC.
Yeah.
So
So
it's,
beautiful.
yeah, it's definitely, I'm so happy that I stepped into this role and realize how many people can be helped by this. And,
Mm-hmm.
back to being a registered dietitian, it's something that all dietitians struggle with, is the fact that the general population typically doesn't understand the difference between a registered dietitian and a nutritionist. So I
Mm-hmm.
think this is important to actually go through really quick. So to become a dietitian, you have to go through, getting an undergraduate degree. They're actually requiring a graduate degree or a master's starting in 2024. And we also have to go through a year-long internship that we have to pay for, and they don't recommend working during. So basically, you're paying to be an intern, and then you have to pass a board exam to become a registered dietitian. And board exam is not easy, let me tell you that.
Yeah.
And whereas a nutritionist, anyone can go online, get a certification, and call themselves a nutritionist. So it's important, to be asking these questions and make sure that, who you're working with knows what they're talking about. There are some fantastic nutritionists out there, but I just like to caution people and educate them on that end. So
Yeah, absolutely. And that's like, yeah, 100%, because it depends on the, like what you're asking for, what you're trying to get, right? Because it's like, like same thing with my PT degree, like there's a difference between a PT and a personal trainer, right? But exactly, I think it's really cool that we can have both ends of the spectrum here, of this one of like, yes, like I am a medical professional, I have my degree, I've put in the work, but also, I have these other titles I hold that are very experience-based and experiential. And I love that both of us get to hold both of these worlds so closely, because and that I think really speaks to the beauty of like, kind of like this day and age, because it's like, our ancestors, like the female healers of the past, like, they did not get any traditional training, and they were still able to have massive impact. And, when the medical system sort of took over, and sort of like the patriarchal medical system, there was definitely a push towards, heavy like education and over medicalization and, all of that. But I think it's really cool that, like I said, in this current state, we get to kind of live both of, yes, I was able to go to school, I can stand in a room of doctors and my voice is equally as powerful. And I also know that I have other other knowledge and wisdom that is valuable, even though it's not, what someone else might deem,
right. And I'm sure you and I could talk about this forever.
Yeah.
I wanted to dive into hormones.
Yeah.
I feel like you have so much knowledge about just the whole topic of hormones. So I wanted to see if you could start at the beginning with the simple question of, what are hormones?
Yeah, beautiful. And I love this because I think if we want to go deep, we need to step back and get a ton of context first. And so hormones, I feel like they seem really scary. They seem like this like otherworldly thing, but hormones are actually really simple and really fundamental pieces and components of who we are. So the hormones that circulate through our body, their purpose is to let the organs and organ systems of our body communicate with each other. So your body runs on what's called feedback. So in order to maintain homeostasis or balance, the body is constantly checking in with itself. And it's saying, okay, where am I at in this level? Where am I at with this level? And if it's too high, it sends a signal and tries to lower it. If it's too low, it sends a signal, tries to bring it back up. So it's constantly working to maintain balance. And the different parts of our bodies communicate via hormones. So a hormone is a chemical messenger that is sent out to communicate a specific message. Does that make sense?
Yes, yes.
So, yeah, so it would be like if we were on a team and you know, you're a team member, I'm a team member, and I'm saying, Callie, I need more information, and you tell me information until I say, Callie, stop. And what I use is my voice, but since the team members of our body, the organ parts of our body can't speak to each other, they send out hormones. And the
Got
cool
it.
thing to remember is that different hormones, our body is really like efficient. Like many hormones do multiple different things, although they represent or send information for multiple categories. You know what I mean? So like estrogen isn't just, one thing. Cortisol doesn't do just one thing. Like it does multiple things, and it's just it's one of the efficiencies of our body, and it's really cool to keep that in mind.
Okay. So what are the most, I guess, important hormones for the IC community to know about?
Yeah, so I think we have many, many, many hormones. I tend to focus on the menstrual cycle hormones. And I think for anyone looking to improve their overall pelvic health, their cycle health, looking at those core hormones is really important. And then the only other ones that I would also say is like the stress hormones and the androgen hormones. So the stress hormones are, clearly like the hormones that induce our stress response. And then the androgens are the group of hormones that we typically associate them as like the male hormones, but we have them too. So testosterone's in that group.
Mhm.
And that's important for us as well. But we can start with the female menstrual hormones. And so the big players there are estrogen and progesterone. And those are the two key, and I try to be careful when I have this conversation because I can list off so many things and I don't want this to get cloudy or confusing, but there's four in the menstrual cycle. So the other two are FSH and LH, but we don't have to talk about those here and now. But yeah, estrogen and progesterone are the two biggest ones. And if you chart your cycle and track your cycle, you can sort of notice trends that'll help you determine what's going on with your estrogen and your progesterone.
Okay, cool. So how can people track I guess, how can females track
Yeah.
their menstrual
Yeah,
cycle?
people who menstruate, right?
Yeah.
Yeah, anyone in a bleeding body. Yeah, so there's a couple different ways. Obviously a lot of people have just like apps on their phone where you can track like today I'm bleeding, today I'm not. And those apps try to predict ovulation. However, I would caution people that those apps are only using like very limited data. And so when it says like you're ovulating now or this is your fertile window, that is just a guess. And so that is, I would not say like the preferred method of tracking. Now there's another method of tracking called the fertility awareness method. And so through the fertility awareness method, you use different biomarkers. And so a biomarker is just, so bio meaning life and marker meaning, kind of like a signal, different things going on in your body that you can track to gain more data. So one of these being a basal body temperature. So your basal body temperature is a just more specific reading of your body temperature. It has one more decimal place. And you can take it you should take it first thing every morning, and you can track your temperature, and you'll notice our temperatures changes throughout the month. And so when your temperature rises and peaks, so are your estrogen levels. And usually after that peak of temperature is when you can expect ovulation. So that's one example of a biomarker. Another one is cervical mucus, the stuff you'll find in your panties, or when you wipe, you'll feel, different sensations. And then there's even a couple more, but those are the two most basic common ones that I think everyone can be tracking in themselves.
Okay.
Mm-hmm.
So can you talk a little bit about the different phases of the menstrual cycle?
Yeah, for sure. So, okay, stop me if this gets like kind of, if I need to repeat anything, because
Okay.
there's so many things, like so many layers to this.
Okay.
So the different phases of the menstrual cycle. So we can start. So basically, the way I describe it, a lot of people will say there's 4 phases. I say there's 4 energetic phases, because when it comes to the physiology, like the actual science of what's going on in our body, there are 2 phases with 2 events. So the first phase being the follicular phase. In this phase, estrogen is rising. So the body is preparing an immature follicle to mature into an egg. So as the follicle is maturing and becoming a mature egg, it releases estrogen. So during that process, that is what causes estrogen to rise. The rise of estrogen causes, the uterine lining to thicken, and a whole bunch of other things happen at that time, right? So the follicular phase starts with that. The egg is maturing, estrogen is rising. Then once estrogen has risen, the event that happens is ovulation. So energetically, ovulation is a phase. We have a phase where we're high energy. So let's go back a step. The follicular phase we would call our inner spring. So energetically, that's like your energy is rising, kind of like spring. New life is budding. The flowers are opening up. The sun is coming out. So estrogen rises, energy rises. Okay. Then that first event, ovulation. Like I said, this is an event. This is one moment in time. Ovulation is the moment that the egg leaves the ovary, and like it pops out. That's ovulation. And now it begins its descent into the uterus. That phase energetically is our inner summer. That's when we're very high energy, high libido, like very social. And it makes sense, right? Like the body has just released the egg. So now is like peak time to get pregnant. So our body is like, yes, go socialize, go have sex, go enjoy life, right?
Go have sex.
Yes, go have sex. So exactly. So our hormones are working for us to, accomplish the task of getting pregnant. So that was the first phase with the first event. After that, we enter into our luteal phase. And so our luteal phase is our inner fall. So after ovulation, we start kind of coming down, we start to become a little more inward. Energetically, that's what's going on. We're slowing down, more reflective. It's a really nice time for reflection. But physiologically, what's happening is now progesterone is taking over. So estrogen has come down, and now progesterone is rising. So progesterone is the hormone that is necessary to maintain a healthy pregnancy. So progesterone is the hormone that's saying to the body, like, okay, wait, everybody wait, pause. We have an egg in the uterus. It could get fertilized, it could get implanted. And if it does, I'm going to make sure it stays implanted. And so, so that's what's going on at that point. Progesterone is saying everything pause, and waiting to see if the egg gets fertilized. Then if, you're a certain number of days passes, whatever's normal for you, everyone's luteal phase is different. So what's happening is the corpus luteum is sort of breaking down and that's what creates the progesterone. Once the corpus luteum has broken down completely, all hormone levels have now effectively dropped, and we enter into our second event, which is the bleed. So your bleed, day 1 bleed, is technically day 1 of your cycle. So that is also kind of like a part of the follicular phase, but that's why I call it an event, because it's part of a different phase. But so in this event, we're bleeding, and yeah, so physiologically hormones are low, and energetically this is our inner winter. We have slowed down. Everything is kind of cold, not cold, but it's stopped. There is hibernation is happening, rest is happening. We're going inward. Um, and so yeah, so that's that winter season, that energy of rest. And like I said, physiologically, that means all the hormones have come down to a quiet, and the body starts, it prepares to start again with a fresh new follicle, and we're back at the follicular phase, inner spring, ramping up.
So that's like a 28-day cycle.
Yeah, 28 to 35 is considered normal. And so, yeah, it's important to track and see kind of what your normal is, because everyone's a little bit different. But yeah, that's the entirety of the cycle.
Okay. Yeah, I'm pretty sure that I am picking up what you're putting down, even
Okay.
though it is a little bit,
It's a lot.
yeah, yeah, for sure. But my question that I was thinking about that whole time is, for the people with IC who notice they get a flare at the same time every month,
Yeah.
like what is going on there?
Yeah. So I did some research too to confirm this. What I typically see, and what my thought is that it's usually during that beginning, that follicular phase, when estrogen is rising, and it's the change in estrogen levels that can cause increased discomfort, let's say.
Mhm.
So my understanding of IC is, it's autoimmune and inflammatory. And so if we have too much estrogen, so it could go either way. So if you have too much estrogen during that time, it can cause the inflammatory response to be increased. So it can cause your body to be fighting itself, essentially, because of that autoimmune component, even harder. So if you're noticing, if you're noticing a spike in, like, or a flare up, essentially, during that follicular phase, it could be an indicator that estrogen is too high, or that your estrogen is kind of working against you. Now I say could with like a really hard underline, because there are so many other components here. Another hormone that I'd love to highlight in this moment is cortisol. And cortisol is another thing that can really impact the way anyone experiences any sort of pain condition. And so cortisol is our stress hormone. And if you are having too much stress, or too much of any sort of emotional or physical tax on the body, something that may have been marginally painful could be excessively painful. So, and this is why in my work we do a lot of, like we said, like holistic sort of treatment. So it's like, yes, what are your physical symptoms, but also, as you're tracking your cycle, like what's going on emotionally, like what are your emotional triggers, what emotional traumas do you have that may be influencing the way your body perceives your environment, and therefore responds to your environment.
Mm-hmm.
So
Okay.
that's one sort of like tail of this conversation. The other thing I wanted to bring up with estrogen, as far as IC goes, is that estrogen, when it's too low, can actually cause like excessive dryness. And for something like the bladder, if the bladder isn't like well lubricated, it isn't well hydrated, essentially, that can also cause a lot of discomfort. So, kind of, again, tracking your cycle to see, is it when my estrogen is low? Is it when my estrogen is high? And am I kind of tipping on either extreme of too low or too high?
Okay.
And kind of extrapolating from there.
So if it's determined that the issue is low estrogen, I know that there are doctors who can prescribe like an estrogen cream, or like suppositories. Do you know of any other potential treatments for that?
Yeah. So using a medication to help is, like, I try to be really careful about this conversation, because medications are not bad. They're never bad. It just depends on what the intention is behind it. Are you trying to sort of like quick fix what's going on? Or are you interested in kind of taking a deeper approach? Because our hormones can be influenced, and I'm sure you're a huge proponent, but of our diet, like with our diet, we can change the way we experience life through what we eat. So when it comes to hormone health, one of my go-to things that I'll give everyone kind of right off the bat, if they're having any sort of like cycle, any irregularity, is seed cycling. And that's when it's like a specific protocol of seeds to have at different points in your cycle. And it just supports your hormone function kind of overall.
Ooh, can you go
Yeah.
into that more?
Yeah, absolutely. Yeah, seed cycling is great and it's really easy. So basically, like how I said, we have those two phases, follicular and luteal. In your follicular phase, so all the days up until ovulation, you have a tablespoon of pumpkin seed and a tablespoon of flax seed ground up. So you get like one of those like those coffee grinders where you put the coffee beans and it grinds them up. So you put it in there and then you eat them. You do whatever you want. You put them on a salad. You can put them in a shake. You can just eat them straight. I've never done that, but yeah, find different ways to intake them. And then from after ovulation to right up until day 1, your bleed, you have sunflower seeds and sesame seeds, again, ground up and ingested. And yeah, they're really helpful because seeds are a really great source of fat and protein. And like I said, those specific ones before and those specific ones after are really supportive to, the estrogen cycle and then the progesterone cycle.
Okay. So and you've seen, in your clients, like that significantly helps them?
Well, I mean, it's helped me tremendously, and I have seen improvement with people. That may not always be the only thing. I don't want to like
Right,
give
right.
any false hope with just seed cycling,
Right.
but yeah, it can help, and I think it's a really great starting point for number one. It helps you kind of like it's one thing that can keep you in alignment with tracking your cycle, which is really helpful, and then even beyond that, of really letting yourself know and letting your body know of like, it is not very difficult to make these changes, and small changes can have significant impact, so even if seed cycling only helps 10%, but it helps 10% and you've sort of cultivated this deeper relationship with tracking your cycle and taking in food, I think it's so helpful. And for some people it does help 50%, 70%, but I try to be really careful about these sort of these answers.
Yeah, for sure. Is there anything besides the seed cycling that can help with that estrogen imbalance?
Well, it depends. Again, it's such a unique, everyone's body is so unique. And so I think taking the time to really assess exactly what it is and exactly how the body is responding, is kind of key in all of this, because there are different food protocols that someone can be on, and that can help. There is protocols, right? But beyond that, and again, where my work kind of comes in is sort of like the understanding of like, what's your relationship with your body? What's your relationship with this season? What's your relationship with the pain that you experience in this season? And like sort of what is your like adaptability and willingness to try new things? So yeah, and I'm sure you even have a good experience with like the elimination diet, and sort of navigating that of, what works and what doesn't can change so much from person to person.
Yes. Oh my God, you're preaching to the choir. Like
Yeah.
every single person that I have worked with is so unique,
Mhm.
and everybody has their own unique triggers. That's like the thing that I'm trying to drive into everybody that has IC. You're most likely not going to be sensitive to everything on that IC diet list, but
Right.
the only way to find out is through an elimination diet. So,
Right.
I
And
mean,
it's really interesting when we talk about even like the gut microbiome, right? Because like take something like meat. Some people might argue like if you have high estrogen, you should limit your meat intake. And, I personally, I'm vegan, but that really works for me. But I am very hesitant to tell my patients or my clients like, you should also go plant-based or you should also be vegan, because I know for some people, depending on their microbiome, meat is very important and very necessary for them in their process of feeling like they've gotten all of their nutrients and feeling healthy and feeling fully functional. And there's a lot of mixed research too. So, because for a lot of what I've seen and read, I think that's one of the bigger sort of like suggestions of like, oh, your estrogen's too high, reduce, like, don't take in any extra estrogen, and, via, meat. So like I said, it has a lot more, and this is why I think, the medical community is moving a lot more towards the holistic end of things, because it's we can't just be telling everyone like, this is the answer, this is the quick fix. Like, we need to have a conversation, and part of that is, what do you want? Like, if I said to someone like, your estrogen's too high, stop eating meat, stop eating dairy, only eat this, but someone's receiving that and going, well, I don't really want to do that,
Right.
how is that? And then again, like with the work that I do, like, does that bring up an emotion that now all of a sudden you're doing what I'm telling you to do, but your stress is through the roof and you're feeling some level of sadness or whatever. And then there's even like the emotional piece of eating. Like, we eat to soothe sometimes. So there's so many
Yes.
layers.
And the IC community as a whole is just terrified to eat. And
Yeah.
that food fear
Yeah.
causes additional stress, causes additional symptoms. And it's just like this crazy chain reaction.
Yeah.
And, I think the issue that I have with some practitioners, whether they be in the just regular world or the IC world, is when they tell every single person to follow this diet, like,
Right.
or to follow, like, I've seen people in the IC world say everybody should be avoiding all high oxalate foods. And I'm just like, no, A, everybody's different. B, you're creating more food fear for people who aren't doing that.
Yeah.
And it's just so mental, and just putting every single person with this condition into one boat. It's
Yeah.
not appropriate, in my opinion. I think there's no one size fits all approach for this condition or a lot of other conditions. And like,
Exactly.
there's people out there that are like, oh, you should drink celery juice every morning. And I'm just like, that's just, there's so many things that are wrong with that statement. And I don't want to take up too much time talking about this,
Yeah,
but
but
yeah,
no, but like, I totally agree. And like, I think, oh my gosh, like, if there's any boat we should all be in, it's the like, learn your body boat,
yeah,
because that's the only thing that we really truly have. And it's like, I don't think enough medical doctors, MDs are are pushing that, and are encouraging that, and are saying like, okay, because it's a slow process. It's like a long, slow, dedicated process. Like, you need to be willing to sit with yourself and track and notice what's coming up, and make changes slowly. And so again, like, this is the core of my work. Like, I really want women to know the power that comes with learning your unique language, the language of your body, and then learn to love it, and then learn to listen to it. And it's layered. And so, like
mhm,
you said, for all, this is across the board, it's not just IC. And I think the IC community definitely has like a special seat, though. Like you said, like, there is so much in that community of like, with the food fear, with flare ups, and there's so much. And I think the best thing to do is to really give that pain a voice, and listen to what it's trying to teach you about your body, because all of our symptoms are trying to get us to understand that something is out of balance in the body. Like I said, we operate on feedback and balance. And so when something is out of balance and the internal feedback loop can't fix it, there's a symptom. And that's your body like, hey, hello, I need your help, we need to do something about this. And the traditional sort of like, take a medication to stop this, like, to mask the symptom, isn't fixing the root cause. It's just making the symptom manageable. You know what I mean?
yeah, it's like slapping a band-aid on it.
Yeah.
Um, yeah, and it's interesting when, you were saying to learn or listen to your body and learn what it wants to eat or to be nourished with.
Yeah.
Like, that sounds easy, but it's really it's hard work.
It
And
is.
I
Yep.
think a lot of people just skip over that and go right to a medication or a supplement or a procedure. And that is, I think is normal, a normal response
Yeah.
to being human. And that's something that I did when I was diagnosed. They told me, do these diet changes and go to pelvic floor PT. I was like, heck no, I'm not
Yeah.
doing that. Like,
Yeah.
no, I'm not changing my diet. And so I went for the meds. I went for the painful treatments like Botox in my pelvic floor. I got the installations. I had a surgery. Like it was all so backwards that once I hit rock bottom in trying all those things and nothing was helping, I started to look at my diet. I started to manage my stress. I started going to therapy and just doing things that, connected me more with my body. And that's when I started to see improvement in my symptoms. So I think it's important to point out that, whichever avenue you take is fine.
Yeah.
I feel like if you start working on these things now, then yes, you will most likely save some time. But even if you don't and you end up back at it maybe years later, that's fine too. I don't think there should be any, level of guilt or anything like that. I think it's
No.
absolutely normal.
Absolutely. And like again, like a big part of my work is processing this emotional piece because there, like you said, like there is no shame in just owning where you're at in your journey. And like if you can say with clarity, like at this point, like that's the other thing, like if someone is having so like a ton of pain and like they get prescribed, let's say birth control or whatever medication, like that can be incredibly helpful and life changing, and that I really want to validate that for a moment because, there is no shame in saying, this is what I want for my life right now. And this is the choice I'm making. And this is all of this like emotional work, a lot of times is to get to the point of, this is my truth, this is my reality and this is the consequence, and there is no shame in any of that. I can see it clearly and therefore I accept it. And so, if it's like, this is my reality, I'm my truth is I'm in school and I want to be able to get my degree and I want to be able to do this all pain free. I'm taking a medication there and the consequences of that are X, Y, and Z. That's fine. Accept it, allow that peace to sit in your body. And then, like, like how you said, if you get to a place where you're like, this isn't for me anymore, give yourself the grace to say, like, no, thank you. I am deciding to switch and course correct. And now my truth is that I want to learn the language of my body. I have the time to do this. Or even if I don't have the time to do this, I'm committing to this regardless, and this is the reality I'm creating, and these are the consequences. And in which case, like the consequences are different. There's still a consequence. I think in the coaching community, sometimes we have this tendency to make everything sound so like perfect, and like if you do the work, like life is great. And it's like, no, like getting to know your body like is hard. There's a lot of trial and error. There is discomfort in the process, but you have to learn to love the process and stay committed to the truth and the reality that you want. And that's why, like, I really felt that the emotional energetic component of this work was absolutely necessary for almost all pelvic patients or clients, because when it comes to the pelvic floor and the pelvis, there's so much emotional energetic charge, and we deserve to honor that just as much as the physical symptoms.
Yes. Oh my gosh. I feel like this is such a powerful conversation
Mm.
that so many people need to hear, including myself. Like, I used to feel guilt or shame because I went for, the more like the medications and, everything I explained earlier. And, that's because I trusted that my doctors, knew what was best for me. And, the doctors are just trying to help you, but
Of course.
they're not, they're not gonna, say the things that you're saying because they don't have time usually. And, they're trained in a more, medical method, I guess you could say.
Yeah.
So, it took me a while to come to terms with the process of me getting to where I am today. And, yeah, it kind of sucked along the way, but, it helped me to, realize how important diet is and helping people, just
Yeah.
make those changes, start feeling better. And, it led me to starting this podcast. So, and
Yeah,
that's already helping so
absolutely.
many people.
Yeah, and that's beautiful. And like that, what you just described is such an important part of the process that I think a lot of people tend to. It's not that we neglect it. I just think we don't think about it sometimes. Like the idea that what I thought was a good idea, and again, like what I came to peace with, what I was confident in, still in a way caused me trauma.
Mhm.
And that can be true for anything, right? And both, like I say this all the time, like two things are allowed to be true at the same time. It can be true that that was the best decision for you at the time, and it can also be true that that experience was traumatic. And it's important to give that the space that it deserves to be processed and to be seen and to be released, because all of the emotion that we experience and all of our the beliefs that we carry about certain experiences, they stay in our body. And unless we are intentional about letting that move through our body and be released from our system, so we're not really carrying it, because our muscles carry tension, our fascia, our connective tissue carries tension, our operating systems will be dysfunctional if they're carrying tension or stress. So it's important to create space for that process. And like I said, like we don't think about it sometimes. I have a really almost like funny example. Like I haven't talked about this with anyone except my husband, but I think it really fits. I went to get a cavity filled a couple weeks ago, and this is an example of something that needed to be done. I wanted the cavity filled. I knew I had to do this, and I was like, yes, I'm happy to do this. No red flags anywhere. So I go to get the cavity filled, and the entire time, like, the dentist didn't explain anything to me. The entire time she was talking with her assistant about like random stuff. Like they're talking about how many TVs they have in their homes, and like very like it felt like no one was paying attention to me. It was painful during the process, and I said like, this hurts, and she was like, it's okay, a little pain's fine. And it was just a very uncomfortable experience the entire time. And as soon as I got in the car and called my husband, I was like, I need to be seen and that I'm really upset in how this went. And I bawled like I never would have expected, but I had to cry, and I had to allow that sort of like sadness and, almost grief of how I wanted the experience to go and how it didn't actually go, let that pass through. And for a minute, I was like shaming myself, because I was like, you're crying about a cavity being filled. And then I was like, no, like I am crying about a cavity being filled because my body did not appreciate how it went. And I'm sad about it.
Wow. Yeah.
And
Oh, I'm
I felt so much better after. And I'm, yeah, really happy that I knew to do that and was willing to do that and had the support to do that.
I am positive that the majority of these listeners are or can relate to this, especially going into any sort of IC doctor, like a urologist, urogynecologist, pelvic floor PT, dietitian, and not having that visit meet your expectations or feel like you're not being heard,
Yeah.
and leaving that and just feeling this grief. And it's important to, let that out, or even just tell somebody about it or journal about it. Just let it out.
Yeah, yeah. And I think the biggest thing here is because women, especially, like we are told, I don't know how many times since we start puberty about any symptom, like this is all in your head, or this can't be true for you, or you're too young to experience that, or the classic like have a glass of wine, like and all of these things are so invalidating. And after hearing it so many times, especially if you're struggling with just finding out about a diagnosis, or you're just learning about a diagnosis, and so the biggest thing that we have to constantly encourage each other in is that like you deserve the quality of care that you intuitively believe you deserve.
Mhm.
Because I think all of us have this deep inner like expectation of like, my voice is going to be heard, and like, and or maybe in the beginning I feel like some people get hardened to it, but in the
Yes.
beginning I feel like a lot of us know this intuitively of, I deserve to be heard. I deserve to have my questions answered. I deserve to have a clear understanding of what's going on. And all of these things are so true. And every time a provider doesn't validate those things and doesn't meet your expectations, yes, process it, but know that it is not your fault. And there is someone out there that will validate those things. You are not crazy and you are not wrong for wanting those answers.
Right. Yeah. I mean, if you're not being heard by your doctor, don't go back to them and try to find somebody that actually listens to you. And I feel like the majority of us have to experience 1, 2, 3, whatever number it is, doctors or practitioners that aren't listening to them until they find that one person that they really vibe with, that is hearing them. And I feel like I don't know how to describe that feeling. I guess it's a validating feeling. You don't feel crazy anymore. It just is kind of like a high when
Yeah.
you feel that, you know?
Yeah, you're like, finally I'm being seen. It's like, to feel like you've just not been seen, like there's been this veil over you the entire time. And I think it's very liberating to feel like you're being seen clearly, and everybody deserves that. Yeah, I'm such a big proponent of it because I know that so many people don't, and I think a big part of this is the language. One of the tools I try to give women is sort of like the languaging to speak to doctors. And one of my favorite ones is like, if you say something and someone invalidates it, to say like, or especially if you want a test done, or you want something looked in further, of like, okay, I see that you're not willing to entertain this, thing that I brought up. Please make a note in my chart that you refuse to look into this.
Mhm.
And like, you're allowed to say that to a doctor. You're allowed to say, you're basically holding them accountable. And so having the languaging that you get to go in with prepared, of like, please look into this, or, whatever it is, or these are the exact hormones that I want tested, or are like, I want a panel run on. It's very empowering. So I think language is sort of another thing that we get to explore when we, as at least in my sessions with people, of how can we navigate your next doctor's visit, or
Yeah, I love that. And the episode 1 of this podcast, I had Jess Talbert on. She's a chronic illness mindset coach, and she said very similar things. So it's great that there are people out there that are helping
yeah.
people in the chronic illness community just advocate for themselves.
Yeah, 100%. Because in Western medicine, I feel like there isn't a ton of, I don't want to say there isn't advocacy for the patient, because I don't think that that's true, but I think self-advocacy is so deeply important, and that comes from a place of feeling empowered in yourself and what you deserve, and that's why I like my work as an embodiment coach, I feel is so necessary to the rest of this work.
Mm-hmm. Yeah. So quick switch of gears here. I
Yeah.
know you wanted to talk a little bit about cyclical living. Can
Oh,
you
yeah.
dive into that?
Yeah, absolutely.
Very
Yes.
interested.
Yeah, so kind of like how we were talking about before, how and I feel like it was brief and it was kind of quick, and you may,
Yeah.
like, I don't know, I feel like listeners may have to go back and just listen to that part again, of
Uh-huh.
the hormones and the inner seasons. But basically, your inner seasons, those are the energetic phases, the 4 phases: the inner spring, summer, winter, no, summer, fall, winter. But those 4 seasons are the seasons that you can expect to happen within you as your hormones shift and change. And cyclical living is basically just saying that I understand that this is going to happen. I embrace these changes, and I will, sort of model my life around these changes so that I can leverage my cyclical nature to serve me best. And what's important to note here is that our society, be it, a patriarchal society, is based on the testosterone cycle, which is a single day cycle. Testosterone is high in the morning and low at night. So this is why, we all live in this model of like, we all wake up every single day, we go to work, we eat dinner at night, by the end of the day, we wind down, we go to bed, and we sleep, and then we start again. People who menstruate operate on a 28 to 35 day cycle. We operate on the moon cycle. So we have a phase of time where our hormones are rising and we're reaching that sort of peak. And then in the second half of that, our hormones are decreasing and we're reaching, like an energetic low. And so for women, it's important to notice that different tasks will happen more easily and more fluidly if they're done at different parts in the cycle. So for instance, I am at day 6. So I just finished my bleed and I am in my inner spring. So bleed was inner winter. Now I'm off of that and I am just starting my inner spring. So I even noticed today, because I track and I've been paying attention for a while, I noticed a shift in energy of like, I'm almost like turning to my work a little bit differently. Like I am more excited about getting to work or starting to work, or I'm not dreading sitting at my laptop, right? I can expect within the next week that my energy will continue to rise. And in this phase, I will strategically spend more time creating content, host, like being a guest on podcasts, like this was perfectly timed for me. Doing meal prepping, doing all the things that require a lot of energy, and that I'm, willing to put energy toward. So inner spring, energy rising, increased productivity. Then when I'm around the time of ovulation, that's why this is, like I said, ovulation is a moment in time, but energetically, a few days before and a few days after that moment in time is a phase. And this feels like inner summer. This feels very much so like a peak. So in this time, I will be, and anyone experiencing this will feel very willing to socialize and very willing to, spend time and go out and be hanging out with friends. Again, like the go have sex sort of mentality. So if you're kind of planning your life around this, that's just something to keep in mind, right? This would be a good time to plan your social events. Then you move into that energetic fall, that luteal phase, that sort of decline. And this is a time to be more reflective, more inward. Things start to slow down. And so in this phase, you can expect that like it may feel more frustrating to spend an 8-hour day at your computer. It may feel like you don't have the energy to deal with like really tedious conversation. And this phase in our cycle gets a really bad rep because it is the couple weeks before we bleed, and that's everyone's like, I'm PMSing, I'm having all these mood swings, I'm rude, I'm this, I'm that. And the reality is that and each of these phases, we could go so deep, but each of these phases has an associated archetype. And so an archetype is just something almost like a model that you can look at to kind of gain inspiration from. You don't have to be the archetype. It's just an association. And so the archetype for that phase is the wild woman. And the wild woman is fierce and she is unapologetic and she is shameless in her expression. So, in the work that I do, like there's a real moment that I have with people of like, what if we didn't call that like, your mood swing time, but that was like your fierce time.
Oh my gosh, wait, my boyfriend calls it my rage monster.
Yeah. What about like rage goddess, right? Like
yes.
what is our languaging around this? What are we embodying? Because if you go into that phase like, oh, I'm going to be a whatever, and it's negative, like you internalize that. But if we go into this like, I am a rage goddess and I love this time and I am willing to tell you the truth, like that's a really big characteristic of the wild woman of like, I'm going to tell you what's true and I'm not going to shade it with any beautiful color, and like you think of fall, like the leaves are no longer these bright colors. They lose their color and they're all just their base underneath, what's left underneath without the color, the true form, right? So yeah, that's that phase. And so again, cyclical living means like in this phase, I am planning for this. I know that this is coming and I embrace it. I love it. And I plan for it with excitement, And then the last part, the inner winter, is your bleed. And at this part, it's really, and I'm such a huge proponent. I know it's not possible for so many people, but if you can plan your life around your bleed to be able to rest on those days, at least the first 2 days, I usually tell people it will change so much. It changed my cycle in my life entirely. Just being able to relax on those days and to tune in and to really give yourself the space to come into community, almost like to commune with your womb and say like, I see you, I see that you are contracting and releasing blood, and I am present for that. I am present for this shedding. And energetically, it's like, what else can you intentionally shed during this time of the month? You know, this phase energetically is associated with wisdom, and the archetype here is the crone, which is like the elder. So if you take time to really be present and to let any wisdom come through, it's a really potent time to integrate, really. And what's the one thing I really do want to note is that the bleed that you experience, like the cycle that you experience, like let's say this month, has influence from the past 3 months. So the stress levels of the past 3 months, the way you experienced your last 3 bleeds will influence the way you experience this current one.
Wow.
Yeah.
That's
Yeah.
amazing.
Yeah. So sometimes if someone's like, I had a really bad cycle out of nowhere, you know, I'll say like, okay, like let's look back. What have the past 3 months looked like? What was going on in life? What can we kind of learn from it? But yeah, cyclical living is really kind of like putting your womb first and recognizing like, no, I don't operate on the male sun testosterone cycle. I operate on a different cycle, and that cycle's beautiful, and that cycle is powerful, and I like get to, you know, embrace all these versions of myself without shame.
Yeah. Oh my gosh, that's amazing. It sounds like cyclical living can really improve most aspects of your life.
Mm-hmm.
So mentally, physically, emotionally, it could help improve your relationships, improve your productivity, just whether that
Absolutely.
be with work or whatever your hobby is, anything like
Absolutely.
that.
Absolutely. And like you said, even just in that quick thing, like working out, like there are different types of exercises to do at different phases to match the energetic like output that your body's willing to meet that day, you know?
Yeah, it makes
So
me
much.
think of like the days when I wake up and I don't feel like working out. It's like
Mhm.
that's probably, in one of those phases that you just said. It sounds like something that I should start doing.
Yeah.
I feel like I just need to wait until a time where I am mentally ready to tackle that.
Sure. Yeah, sure. Absolutely. And I think like, and that can look like whatever you want it to, you know, like does that like what baby step can you take, even if it looks like journaling of like today I feel like, let's say you give yourself a 0 to 10 mood scale every day, and every night before bed you just circle one, and then at the end of the month see if you notice any trend, you know, like it can be as simple or complex as you want it to be, you know.
I love tracking things and
Yeah.
identifying patterns and trends. And I
Yeah.
just think it's so cool to do. If only there was like one journal or tracker that had everything you could possibly
Yeah.
need in it.
Yeah.
That's like impossible because it would be so big and so long.
10 pages per day.
Yeah. Oh my gosh. Well, that was super informative and educational. Is there anything else that, you wanted to talk about, or, any piece of advice for the IC listeners?
Yeah, I mean, I would just say, you know, your pelvic health is so layered and so multifaceted. And, you know, the mission of what I do is to help women really embrace and integrate the reality that, you know, we have a physical body, an emotional body, and an energetic body. And all of those are working together constantly to create the reality that we experience. And so, you know, whether you tackle one at a time or all at once, you know, it doesn't matter. But what does matter is recognizing that they do exist, and that there is something we can do at every level to create the healing that you desire, and ultimately craft the reality that you want. And there are practitioners, you know, myself included, Callie, and a bunch of others, you know, there are practitioners that want to help you in this holistic way, and you deserve it. So
Oh, yeah, of course. We all deserve it. So how can people find you / are you taking new clients right now?
yeah, I am. I actually just started offering a new service that is the most integrative that I can, which I really, really love. I have my regular PT sessions, which are very diagnosis based and physical body based. Then I have on the other end of the spectrum just coaching, which is very emotional based. And now I just started offering kind of like a meet in the middle, what's called a pelvic empowerment session. And this session is really focused on teaching clients how to use their own hands. Everything's virtual. So it would be me instructing you how to use your hands to self-massage, self-assess, and really, again, like learn the language of your body while creating a really safe container to explore any energetic, emotional, or like physical sensations that come up in process. So that's what I've been, sort of pushing for most recently. And yeah, I'm absolutely taking new clients. I'm on Instagram, so if anyone wanted to connect and sort of like start just a DM conversation or something, it's dr.liliana.dpt. And then other than that, I have a website. My husband and I have a wellness practice. He does men's health. I do women's health. And that's our practice is called Sacred Space Health and Wellness Services. And our website is allspaceissacred.com.
Awesome. Are you guys practicing like in a physical location, or is that virtual too?
Yeah, so it's virtual and in home. So we're in South Jersey. So anyone kind of like within a 55-minute driving radius, we can do things in home. He does massage as well, and like movement sessions or wellness sessions, things like that. So he will go in home. And then I go in home for a lot of the PT stuff, especially like pregnancy, prenatal, postpartum. But I am really enjoying the virtual space and moving more in that direction. So like I said, like these pelvic empowerment sessions I'm so excited to do more and more of them because it feels like the core of where the healing happens.
For sure.
Yeah.
Well, thank you so much for coming on and just giving an hour of your time. I really appreciate it.
Yeah, well, I'm really, really grateful and thankful that you see value in what I do and that you hosted me. So I'm so happy we could do this today.
Absolutely.